Senator Daschle, thank you for coming in today.
My pleasure, Jackie. Good to be with you.
The big idea in your book is the creation of a Federal Reserve Board type organization that would create and maintain a healthcare system for the country. How would it work?
Well, it would work much like the Federal Reserve Board does today. The Federal Reserve Board is not the manager of our federal system. What it is the executor, the decision maker, the policy setting framework within which most of the managerial decisions are ultimately made. We've seen with the crisis over the last couple of weeks in our financial markets just what an incredible role that they play. We need the same kind of autonomy, the same kind of political insulation, the same kind of expertise when it comes to health care. Because unlike the popular perception, we don't have just a private system in our country. We have a public-private system. 45% of the people in this country today get their health care from a government program, 55% from the public sector, and so, I should say from the private sector. So you have to have better integration of that than we have today. That's what the Federal Reserve Board does, integrating our public-private systems within banking. I believe that's what a federal health board could do with our health care system.
Well, give us some examples of what kinds of decisions they would be making.
Well, they would start by creating a framework within which decisions involving best practices could be decided. Decisions involving greater emphasis on prevention could be considered. Decisions involving whether or not we could set up say a federal health court to deal with malpractice issues in the future. That kind of decision making, putting greater emphasis on management of the chronic care problems that we have in this country today. But all of those decisions today are largely relegated to Congress. Congress sets some decision making with regard to many of these things, at least on the public side. And the bottom line is most of them never get made or get made well after the fact. Congress is just not capable of being the manager of a healthcare system. And yet it's largely Congress today that has that responsibility. It hasn't worked for the last 50 years. It'll work even less in the next 50. Would
the board get down to the nitty-gritty? And by that I mean, for example, would they issue formularies?
Well, first of all, I want to make sure I clarify that I don't see the board addressing the private side. What we would do is create an FEHB-like system where everybody would have access to a cafeteria of different
That's
opportunities.
The Federal Employees Health Benefit
Federal
Program.
Employee Health Benefits Program. They could go buy a private system, or they could buy a public health care plan. They would have that option. The Federal Health Board would regulate all the 45%, the public side of things, and have the same impact, just like the Fed provides its decision-making with the federal discount rate, not a private rate, a public rate. That has the effect in our banking system of having dramatic consequences on the private side. The same would be true of this. Everybody would be in it. Everybody would have access. We would have a requirement that everybody take their own responsibility. But at the end of the day, it would be the management of that 45% today. I think it's probably going to grow as the baby boomers get older. But nonetheless, you're going to see the Fed take responsibility for that, and formulators could be part of it.
But your thought is that they're involved in the 45%, but because that's such a large number, it would have the spillover effect into the 55%.
Exactly. And there would be a competitive opportunity. People could sign up, could have access to either a public program like Medicare or a private program like any one of a number of the private programs offered today.
In the book, you compare this idea to the British and German agencies. And as you know, there is criticism sometimes of those systems that what these organizations do is lead to rationing. How do you respond to that?
Well, I think we have to recognize that there will always be decisions involving the allocation of our resources. Rationing is such a harsh word, but it is a word. We ration badly today, and no one knows that better than you and Kaiser. We ration on the basis of ability to pay. We ration on the basis of your own eligibility because of a pre-existing condition. We ration on the basis, in part, of whether or not you live in a poor, rural part of the country, like many counties in South Dakota. We ration, in my view, in the most unfortunate way today. So what I'm hoping is we can move away from that kind of terrible rationing to decisions with regard to the allocation of resources that make a lot more sense.
In the Wall Street Journal reviewed the book, and the writer made this argument that the Federal Reserve Board has a far simpler mandate than what the Daschle Board would have. And then he asks, how can a single health board make so many decisions, and wisely?
Well, first of all, it is a very good question. And my answer would be, as I said a moment ago, I think that the Federal Health Board's responsibility would largely be helping to create the framework and making basic decisions with regard to that overall framework, just as the Federal Reserve Board does today. But I don't relegate all of the other managerial decisions to the Federal Health Board. That would still fall within the purview of the public and private entities. They still would have to make a lot of the executive and managerial decisions. It's the framework and the overall executive decision-making within that framework, the larger framework, that I see the Federal Health Board making.
Does it lead to lower costs?
Well, if we don't get lower cost, we've failed. And I think that it is essential that we bring down costs, at least the growth of cost. And I think there are a lot of things we can do to do that. We shouldn't tolerate 30 cents on the dollar for the management of our system today, but we are. I don't think we should accept the fact that we only spend 3% of our $2.3 trillion on wellness and prevention. But today, and for the last 80 years, we have. I think there are so many decisions we could make with regard to the management of our care, chronic care in particular, that could bring down costs, including the utilization across the board of best practices. But there are so many things that could be done that are cost sensitive, that can address some of these issues. There's too much cost shifting in our system today. The uninsured cost the average family about $1,500. And so by having everybody insured, you're going to end some of that cost shifting, and that too could have an effect.
And you also talked about the one hallmark of this board would be its transparency, and that in itself would lead to reduced costs, reduced spending.
Our health system has been described as the most opaque, the least transparent of all of the sectors of our economy today. And I find that amazingly ironic that which affects us most personally, our own health, is that which we know the least amount about. And I think we have to change that. We have to become more transparent, not only at the board level,